Applying for a HIDIS abstraction job or a clinical quality role or quality improvement coordinator or specialist, a program manager in healthcare quality, then this video is for you. I have been in this space for more than a decade now, going close to 15 years. I have helped a lot of people to land jobs in healthcare quality, and I've also conducted dozens interviews for these specific jobs. In my experience, there are common mistakes that I see a lot of interviewers do, which doesn't make them stand out during the interview. One of them being telling a story without organization. A good story will not have impact if it's not organized. You want to make sure that your story is very organized. And a way to be able to do that is apply STAR. STAR meaning, what was the situation? What was the task? What was the action? And what was the result? So a practical question could be, tell me about a time that you identify gaps in care. A solid response could be, in one of my roles, I identified members that were missing breast cancer screening, and I partnered with our analytics team so they were able to pull a full list of the members that were missing these important screenings. And then I also collaborated with our case managers for them to conduct member outreach to assist these members in scheduling their breast cancer visits, right? As a result of that, about 150 appointments were scheduled and 75 screenings were completed, which resulted in a 15% improvement in our measure performance. In this case, you told a story. You were able to identify the situation, which is members that were missing screenings. You took the task you took, reaching out to the analytics team. The action you took, engaging with collaboratively with case managers so they're able to reach out to these members and have the appointment scheduled. What was the result? Our appointment was scheduled. As a result, 75 screenings were completed. It resulted in a 15% improvement in measure, right? That is an impact. So your story is very structured, where the person who is on the other side listening is able to really see the impact of your work. The number two pitfall that I see frequently is speaking too technical or speaking too vague. It's very good to be very detailed and be very specific and provide examples in your response. But you also need to keep a balance between detail and clarity. You don't want to lose the interviewer, right, when you go in too much details where you lose them.